The moment you may decide to go for therapy, inaanza first by you making the decision, and then after that we find a therapist of your own choice, unataka nani, and then after going for a therapy, ukifika hapo, of course maybe to be in a room, ama wengine some squeezy we prefer doing online.
All right.
So if it's online, and then you will present, the first step is for you to present after your therapist amechukua your details. Assurance of confidentiality, because of course the session are very confidential.
Yeah, so that usisikie story kwingine jamani.
Kwingine, and in case usikie pahali, kindly sue us. It's allowed.
For real?
Yes.
Okay. You are listening to Flavor in the Morning.
Yes, you're allowed. And then so confidentiality, privacy, utakuwa explained to you, and then utafanya, there is that aspect of you to consent for the therapy.
Yes.
And then after that tunafanya kuna kitu inaitwa presenting problem. So you will tell your psychologist or your counselor, this is the problem I'm having. So you can mention, maybe I'm feeling anxious, I can't sleep, and then ni hivi na hivi, maybe it's my wife amenipiga usiku. Yes, you will do that, and then after that the therapist will ask about the history of the history of it. So umesema you are anxious. Able to patie historia, ilianza lini, ilikuwaje, maybe ilikuwaje mpaka bibi yako akakupiga ama bwana kupiga.
Bibi kupigwa tena, anapigwa na bibi.
It happens, but hatutaki kuongea anyway.
Hampendi kuongelea hiyo story. You only talk about it when it's the man hitting the woman.
Yes, but not women. But zinatokea anyway.
All right.
Yeah, so after that tumetoa storia.
All right.
You're presenting problem. Then we go to medical history. Atachukua medical history yako. Uliwahi kuwa mgonjwa, uliwahi kuwa hospitali, whatever. After that, if there is any collaborative history, kuna mtu anajua history, tumuulize, sema nini, are you willing to do that?
Right.
And then consent, the counselor will ask, and then because now counselor si kusikiliza tu, kuna documentation also. Anachukua. And then after that tutaangalia your social life. History umekuaje? Are you an outgoing person?
Yes.
Ama we ni yule sasa hivi unaji imekuaje from, so tunaangalia from ukiwa mdogo up to where you are
right
after
now.
That tutaangalia kuna kitu inaitwa vegetative function. Yeah, so tutaangalia unakula aje, unalala aje. Yes, tutaangalia your bowel movement, unaenda kwa choo vizuri, unarudi kwa vizuri. And then after that kuna kitu inaitwa mental status examination. So that is when tunaangalia your mental status examination. Tunaangalia the moment umekuja for session, ulikuwa na behavior, ulikuwa na shake, tukiongea ulikuwa unalia at some point, ulianza kulia. And then after that tutaangalia your voice. Are you loud? Are you calm? Are you voice inatetemeka shaking, si kama wale waimbaji, but kuna ile
there's a shaky voice unaona
huyu naye hayuko sawa. And then tutaangalia your thought process.
All right.
Thought yako ikoaje, una process vizuri thought, story yako iko sawa. And then tunaangalia content. Of course, because the moment I'm taking the history of the presenting problem, nitajua, I will know if your thought content iko sawa. So that will itaniambia vizuri. And then after that tutaangalia na kitu inaitwa after that tutaenda kwa diagnosis. Kuna axis, tunaangalia diagnosis sasa ni nini hivi. So kwa diagnosis we can do, for depression we have assessment tools which we do. So mimi of course sitakwambia uko na depression until
so there's even a diagnosis in therapy.
Yes,
I only heard that in cancer.
Even in therapy we do have that. So I won't just jump to conclusion nikwambie you have depression. You need to do, it's good to take an assessment.
All right.
So after taking the assessment, the assessment itakwambia the level of depression this client akonayo.
Alright.
So after realizing the level of depression, that is when you will know the treatment plans.